Hello everyone, my name is Sheena L. Frank. My presentation is entitled Visualizing the Opioid Crisis, a Data-Driven Story. I'll be walking you through a Tableau dashboard analysis of the U.S. opioid crisis. This dashboard that was originally created by data analyst B. Carter reveals shocking trends in overdose deaths, prescription rates, and treatment gaps. I'll show you key insights, the changes I've made to improve it, and how this data can inform real-world solutions. The opioid crisis is a national emergency. This dashboard helps us understand three critical aspects: where deaths are happening, how drug types have shifted from prescriptions to fentanyl, and who is the most affected. The data comes from the CDC and other reliable sources, making it a powerful tool for policymakers and healthcare providers. The original dashboard includes three main visuals. The heat map highlights states like West Virginia and Ohio with the highest death rates. The line graph shows the dramatic rise of fentanyl after 2015. The bar charts reveal disparities. For example, rural white men aged 25 to 44 are the hardest hit. Filters let users dig deeper into the data. Three critical insights emerge. First, geographic disparities. Some states are far worse than others. Second, while rural white men face the highest risk, death among Black and Indigenous communities are rising fast. Third, the drug supply has shifted. Fentanyl is now the leading killer, surpassing prescription opioids. This isn't just data, it's a call to action. I've made three key improvements. First, a year slider lets users focus on the fentanyl explosion after 2015. Second, new filters break down data by race and age, revealing, for example, that Native American overdose rates doubled in Arizona. Third, I added annotations to explain spikes like the 2013 OxyContin reformulation. These changes make the data more actionable. These modifications transform the dashboard from a statistic report into a storytelling tool. Filters reveal hidden inequalities, like rural areas with high deaths but few treatment centers. Annotations add context, turning numbers into narratives. For policymakers, this means better targeting of resources to save lives. This dashboard isn't just for analysis, it's for action. Public health officials could use it to allocate treatment funds. Policymakers might push for stricter fentanyl laws. Hospitals could train staff to spot high-risk patients. In the field of tribal government compliance, we can adapt this approach and tailor it to meet the specific needs of tribes. Data visualization bridges the gap between numbers and change. This tool would be highly beneficial, especially if we could receive the information as close to real time as possible. A new dashboard for opioid crisis analysis can significantly enhance the operations of tribal compliance departments in several ways, which include, number one, data visualization. The dashboard can visually present data on opioid usage, overdose rates, treatment engagement, and demographic information, making it easier to understand trends and patterns. Number two, real-time monitoring. With real-time data updates, the dashboard allows for immediate awareness of spikes in opioid-related incidents. This timely information is critical for effective response and intervention strategies. Number three, geographic insights. The dashboard can incorporate geographic information systems to highlight areas most affected by the opioid crisis, helping compliance departments to allocate resources effectively and target interventions where they are needed most. Number four, resource allocation. By identifying trends, the dashboard can help in prioritizing resources and funding for treatment and prevention programs, ensuring that efforts align with the community's specific needs. Number 5, reporting and compliance. The dashboard can facilitate compliance with regulations by automatically generating reports on opioid-related metrics, simplifying the process of meeting federal and state reporting requirements. Number 6, stakeholder engagement. A comprehensive view of the opioid crisis can enhance communication with stakeholders, including tribal leaders, healthcare providers, and community organizations, fostering collaboration on initiatives aimed at combating the crisis. Adapting the approach would include 5 key factors, which are: Number 1, culturally relevant metrics. Customize the dashboard to include culturally relevant health indicators and utilize data that reflects the unique challenges and values of the tribal community. Number 2, community involvement. Involve community members in the design process to ensure the dashboard addresses their needs and concerns. Their insights can help define key performance indicators relevant to the community. Number 3, training and capacity building. Provide training for staff to effectively use the dashboard, ensuring they understand how to interpret data and implement findings into their compliance strategies. Number 4, partnership development. Collaborate with local health departments, researchers, and organizations focused on substance use disorders to enrich the dashboard's data and insights. Number 5, feedback loops. Establish mechanisms for community feedback on the dashboard's impact and usability, allowing for continuous improvement and adaptation based on user experience. Given that Native Americans experience a disproportionately high level of opioid overdose, this tailored approach is crucial. By implementing a dashboard that specifically addresses the challenges faced by Native American communities, the Compliance Department can make informed decisions, allocate resources effectively, and ultimately improve health outcomes in the face of this critical issue. To ensure transparency, here are my sources: CDC data, peer-reviewed research, and B. Carter's original dashboard. I'm happy to take questions about the data, my modifications, or how Tableau can empower decision-making. Thank you.